Good evening, everyone. I'm Dr. Vasu Babu. I'm a consultant cardiologist in Maitri Multi-Specialty Hospital, Guntur, in Andhra Pradesh. Okay, today our topic was understanding hypertension. Okay, our discussion will be on what high blood pressure is and how to prevent it. Generally, everyone would like to have healthy or normal blood pressure, but what exactly does it mean? Basically, each time when the heart beats, it pumps blood into the blood vessels. This creates a pressure against the walls of the blood vessel. This is called blood pressure. Normally, in healthy person, it rises and falls throughout the day. But when blood pressure remains high for a longer time and left untreated, it can lead to a serious and devastating health complications. In general, persistent increase in blood pressure higher than the normal blood pressure is known as hypertension. High blood pressure usually develops over time. It can happen because of unhealthy lifestyle choices. For example, not having enough regular physical activity, or like obesity, or like smoking, a high alcohol consumption, and stress, and so on. There are other risk factors that can also increase the risk of developing hypertension, such as age. As people get older, the arteries can stiffen up and narrow as excess fats build up. A family history of high blood pressure. One or more close relatives or family members with hypertension increases the person's risk of developing the condition. Excess salt intake. This is also an important factor which raises the blood pressure. Not eating enough foods with potassium can also increase blood pressure and the risk of stroke and chronic kidney disease. Eating processed and fatty foods increases fat content throughout the body and makes the heart work harder to push the blood throughout the body, hence causing blood pressure to rise. On the other hand, lack of physical activity is also linked to obesity and further to high blood pressure. Another one is stress. Reacting to stress in unhealthy ways or not managing stress can also increase the blood pressure. Moving on, hypertension does not have any obvious signs or symptoms. It is often called as a silent killer. It puts people at risk for several diseases, ranging from cardiovascular problems to kidney failure to stroke and even eye damage and blindness. Hence, early and accurate diagnosis is very important in management of hypertension. Measuring the blood pressure is the only way to know whether person have high blood pressure or not. Generally, when some symptoms do occur, they include morning headache or tiredness, vision changes, buzzing in the ears, fatigue, nausea, or vomiting. If person experiences these symptoms, then one should get their blood pressure checked. Fortunately, high blood pressure can be easily diagnosed. Your blood pressure is one of the easiest and the simplest diagnostic tool which can tell one so much about their current and possible future health. It is usually measured with an instrument called sphygmomanometer. A blood pressure is recorded in two numbers, systolic and diastolic. Now let's try to understand what do these numbers actually mean. A healthy or normal blood pressure should be lower than 120 by 80 mm of Hg, or it can also read as 120 over 80 mm Hg. Hence, the upper number indicates systolic blood pressure, which means the pressure in the blood vessels when the heart contracts, whereas the lower number indicates diastolic pressure, means the pressure in the blood vessels when the heart rests between the beats. If blood pressure level is or more than 140 by 90 mmHg, then the person is having hypertension. And if the person have high BP levels, then he or she might be at risk of developing serious heart diseases. This risk can be prevented and reduced by taking steps towards a healthy lifestyle, such as regular exercise, healthy diet, quit smoking, and reduce alcoholic intake, regular blood pressure monitoring, stress management, and adherence to medicines. If blood pressure is successfully controlled with such lifestyle modification, then it might avoid or delay or reduce the need for medication. So let's take a look into these strategies one by one. First one is regular exercise or physical activity. Exercise can be drug-free approach to lowering high blood pressure. Regular physical activity makes person heart stronger. If one have a strong and healthy heart, it can pump more blood with less effort. So if the heart has to work less to pump, the force on the blood vessels will decrease and lowers the blood pressure. In other case, as we are all aware that age and weight gain are the two major risk factors for high blood pressure. So if the blood pressure is at desirable level, that is less than 120 by 80 mmHg, then exercise can help prevent it from rising as you age. A regular exercise also helps you maintain a healthy weight, which in my opinion is an important way to control blood pressure. One should aim for at least 30 minutes of aerobic activity most of the day in a week. High BP level can reduce by doing regular structured exercise such as brisk walking, jogging, or swimming, etc. The second one is healthy diet. Diet also plays an important role in controlling blood pressure. A diet with a high intake of vegetables, fruits, and whole grains is recommended for hypertensive patients. For lowering blood pressure or preventing hypertension, uh, through dietary intervention, one can adopt a dietary pattern such as DASH diet or as a Mediterranean diet. Eating less saturated fat and total fat, getting plenty of potassium, limiting the amount of sodium in the diet, and limiting alcohol consumption. DASH stands for dietary approaches to stop hypertension diet. Eating a DASH diet that is rich in whole grains, fruits, vegetables, low fat dietary products, and skims on saturated fat and cholesterol can lower one's blood pressure by up to 11 mm of Hg if having a high blood pressure. Reduce sodium in your diet. This is a very important thing we should follow. Even a small reduction in the sodium in the diet can improve the heart's health and reduce blood pressure by about 5 to 6 mm of Hg if you have a high blood pressure. To decrease sodium in your diet, you can consider the following tips like read food labels. If possible, choose low sodium alternatives of the food and beverages you normally buy. Eat fewer processed foods. Only a small amount of sodium occurs naturally in foods. Most sodium is added during processing. So you can eat natural products. Don't add salt. Just one level tablespoon of salt has 2300 milligrams of sodium. Avoid adding salt to food. Use herbs or spices to add flavors to your food. Quit smoking and limit the amount of alcohol you drink. Stopping smoking helps your blood pressure return to normal. Quitting smoking can effectively reduce your risk of heart disease and improve your overall health. Drinking more than moderate amounts of alcohol can actually raise blood pressure by several points. It can also reduce the effectiveness of blood pressure medications. Hence, limit alcohol consumption, especially in hypertensive patients. The regular blood pressure monitoring. Some of the hypertensive patients check their blood pressure by visiting doctors, but it is not always possible for patients to visit doctors and check up their blood pressure. Hence, most often, I advise patients to self-monitor their BP levels at their home. Self-monitoring helps person to measure BP at different times throughout the day and over a longer period of time. It also assists doctor to get a more complete picture of person's blood pressure reading at different times. Further helps us in better prediction of cardiovascular morbidity and mortality rather than single routine blood pressure measure that occurred during the visit. The next important is stress management. By learning how to relax and manage stress can improve emotional and physical health and lowers high blood pressure. Stress management techniques include exercising, listening to music, focusing on something calm or peaceful, and even meditation. Uh, the next important point is adherence to medicine. This is the most important. Most of the patients won't take medication. They feel that after taking medication, the BP will come down to normal level, and they think they don't have BP. So this should never happen. So a medicine to lower blood pressure may be recommended by doctor. If your blood pressure is consistently high, usually at or above 140 by 90, adherence to medicine is very important, uh, as it controls your blood pressure regularly. At last, I would like to suggest that there is nothing more precious than having a fit and healthy life. Adopting healthy lifestyle can help us to enjoy long and healthy life. High blood pressure can be prevented as well as controlled in many ways. Keeping blood pressure in the normal range is very important in preventing cardiovascular complications. It is very much possible to maintain normal blood pressure levels with regular monitoring and preventive care. Hence, hypertension control is a very important thing in one's life. If not controlled, they can have many comorbidities in the future, like heart failure, like it can affect the central nervous system, it can affect the kidneys, and even it can affect the eyes. So be careful and adhere to medication and adhere to lifestyle modification. Eat less of sodium, have regular exercise, at least 30 minutes a day, and spend time with the family to relieve from stress. All these are very important points which will lead you to a better life and less of comorbidities. Thank you very much.